So the hip replacement that we do it nowadays is most commonly direct anterior approach, minimally invasive, and we use robotic navigation to place the prosthesis. It's safe and okay to use the hip immediately after surgery to walk and to climb stairs, and the patients are most commonly discharged home immediately after the surgery, the same day as the surgery. You can expect to have a bit of discomfort that's usually controlled well with aspirin and naproxen sodium and Tylenol, and we use cold therapy circulation system around the hip. We have videos that show how to apply that cold therapy system that helps decrease the swelling and the discomfort and the inflammation after hip replacement, and also helps decrease any need for using narcotic pain medication. You can expect to use the walker after the surgery, maybe for the first couple of days or a week, and then the physical therapist will help you wean off the walker. But again, walking, climbing stairs is allowed, actually encouraged immediately after the surgery. So you're moving the limb, you're moving the joint, you're decreasing chances to develop stiffness and to have blood clots, and you're also improving the circulation. So motion after the surgery is recommended as long as it's not excessive and you're not doing strenuous activity like mowing your lawn or doing construction work. We would like to avoid that for the first month after a hip replacement. The dressings, you're going to have some bulky dressings over the hip. It's made out of cotton and some tape that can come off around 3 days after the surgery. And if the wound is dry and there is no spotting on the internal dressings, which are water resistant, you can shower 2 or 3 days after the hip replacement. Keep the wound area clean and dry. Do not immerse it underwater for 30 days after the surgery. So after hip replacement surgery, doing strengthening or range of motion exercises is not usually necessary, except for gentle strengthening exercises. Walking and climbing stairs and doing your activities of daily living is the therapy that we need. So staying active and mobile and moving after the replacement is definitely a good approach.
And how do I wean myself off the walker? Is there some exercises that I can do with the walker to wean myself off?
That's a great question. After, the way I ask my patients is to take some steps while you're carrying the walker.
Okay.
So if you feel like you're kind of like a little bit off balance, then you can put the walker down and start walking with the walker again. But then if you see yourself you're carrying the walker or working better when you're carrying the walker, then it's probably a good time for you to start weaning off the walker.
Great.
And if you're working with physical therapists, they will help you with that staging as well.
And when can I start driving?
If it's the right side, you can start driving when the pain is down and you don't have much pain and you feel like your range of motion is as good or better after the surgery. So usually that happens the first 2 weeks after the surgery. Some patients are a little bit more delayed. Some people can go back to driving earlier. But when you feel like your strength is back to normal, range of motion back to normal, and there is minimal pain in the hip, then it's okay to drive and you're not taking any narcotic pain medicine.